Hey, my name is Taylor Adams, and today I'm going to show you how to perform basic CPR, which is cardiopulmonary resuscitation, on your pet. And in this case, this is Lenny. This is my buddy Lenny. I have already received prior authorization to use this animal. And I have also watched the instructional CPR video as well prior to making this. So the first thing is you'll notice that Lenny is in right lateral recumbency. He's on his right side so that I am able to access his heart on the left side better. I'm going to assess if the dog is breathing. I'm going to safely place down my ear to listen, and if I can see any chest movement, and I have not, which indicates that he needs CPR because he's not breathing. Second, I'm going to open his mouth, and I'm going to safely come down here, and I'm going to look for any obstructions. The best way to do this is to pull the tongue out so that you are better able to look down the oral cavity. And if there is something that is visible that you can see, the best way to do it is to place your finger down there and try and scoop it out. If we do not see anything, then the next thing we are going to do is check for the femoral pulse. I'm going to come down here, and his legs are kind of tucked, but I would feel right about up here. And I'm checking for a femoral pulse. Also, there's other ways that you can check for a heart rate. See if the heart's beating right here, usually under the armpit. And then there's a third way also. You can check right under their front paw pads and check for any heart beating. So now that I have not seen a femoral pulse, I'm going to extend the head and neck, and I'm going to close the mouth with my hands. I'm going to place my mouth with his mouth closed right over his nose, and I'm going to give him 2 full breaths. I'm going to do this so that his chest, I can see his chest rise. I'm going to be careful not to do it too much, that I fill his lungs too much. Also, in between the breaths, I'm going to give 1 full breath, have the chest rise, and go back down. Another full breath, the chest rise, and go back down. So, here we go. I'm going to close Lenny's mouth, come over, and I'm going to Alright. And another indication of his chest was rising, which also proves that there's nothing stuck in his airway, because his chest was able to rise. I'm going to kneel in the dorsal aspect of the patient. I'm going to flex my elbows, and I'm going to hold in this position, and I'm going to locate the area to perform my chest compressions, which is right here. And I'm going to give 30 good, relatively fast chest compressions. And I'm going to extend my elbows, and I'm going to do it like this. And you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I'm going to come back over and I'm going to close this mouth, give 2 full breaths again. All right. Now I'm going to, he's still not breathing. I'm going to come back over here and I'm going to go again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm going to come back over here. I'm going to feel for a femoral pulse. And luckily, I have found a femoral pulse. And I'm starting to see he's slowly starting to breathe again, which is good. But let's say I'm still not feeling a pulse. What I would do is I would continue that cycle of, okay, 2 full breaths, and then start with the compressions again. And I would continue to do that until hopefully we have a pulse and we're starting to breathe. But that is how you perform basic cardiopulmonary resuscitation, aka CPR.